the cloud. Okay. And then we'll put also live on Facebook. So some people which cannot come into our Zoom can see here. So Apitherapy.
Good day, Dr. Stefan. Good day, Dr. Ali Timucin.
Hello, good day, good day.
Hello, Dr. Andres, how are you?
Salam alaikum, Dr. Ali. Thank you very much.
Salam. Thank you very much. Nice to see you.
Thank you so much.
Somebody singing is very nice. We are happy. Okay. Wait a second. Yes, now it's going live also in Facebook. So we can start. And let's see here. Okay, Alexandra is coming. Okay, it should be okay. Good. Let me check. Yes. Good. Yes. Okay, perfect. Now it's perfect. And we have all conditions. And we already started the recording. So now we go to the hard part of the conference of the day, to the best experts in apitherapy, together with our other experts in Romania. But we have here people with huge scientific and practical experience. I mean here Dr. Timucin, Dr. Andres Santiago Castillo. And also we have our Dr. Pavel Cristina from Romania coming, Dr. Ramona Jurcău also. We have also a short presentation from Brazil, from a United States citizen. It will be also very interesting. So let's start with Dr. Ali Timucin. So please, the floor is yours. Activate your microphone. Yes.
Can I share my screen?
Yes, please. Oh, yeah. Oh, sorry. 1 second, because I need to put you as co-host. Sorry. Let me see here the participants. Where are they? Oh, yeah. Now, okay. So I put you co-host. I will make also co-host Dr. Andres Castillo. So now you are co-host. You can share the screen. Dr. Andres Castillo.
Thank you.
Okay. So. Yes, here. Okay, very good. Okay, so yes, you can start now, Dr. Timucin.
Okay, thank you very much. Dr. Stefan, let me share the screen. First of all, thank you very much for organizing such an important and nice event. We are experiencing some difficult days of pandemics. It is coming and going, and it has been almost 2 years now. And we were thinking it will finish soon, but it is still causing problem. So I hope that it will end very soon. Well, we would like to talk about how apitherapy can contribute in our fight against COVID-19. And there are some theoretical issues that we can see the potential of apitherapy in our fight against COVID-19. I would like to share with you some highlights points, and then I think Dr. Stefan will give some practical issues. Can you already see our presentation, or?
No, not yet. Not yet. Okay. We see your screen, but you need to select the PowerPoint. Maybe it's better that you, yes, first you open the PowerPoint, put it at 100%, and then you share the screen.
Okay. How is it now?
Yes, now it's perfect. Yes, it's perfect. It's full screen. You can start.
Thank you. So I would like to share some information about the importance of beehive products in the fight against COVID-19. We are trying to share this information as much as possible in every event, so that awareness of bee products, the importance of bee products, apitherapy products can happen in different opportunities. So we know that COVID-19 is, although it can affect different systems in the human body, it can have a negative effect, especially on the respiratory system. But today we know that it's not anymore respiratory system, primarily respiratory system, but it can affect nervous system, it can affect cardiovascular system, it can affect anywhere, including psychology. And it can be especially severe in patients with comorbid diseases, including obesity. And it may cause to a long stay in the intensive care unit. So we have experienced this in the last almost 2 years. Therefore, we can say that besides using antivirals, well, it's a coronavirus, so using antiviral phytotherapeutic agents or chemicals, but besides using them, the focus should be to ameliorate the functioning of the immune system and to reduce the co-infections and keep under good control the comorbid.
Please reactivate your microphone. Yes, Dr. Pinch. Yes. Okay.
So this is the point that we have the opportunity of using apitherapy, because we said that we need some antiviral agents, but besides this, we have to ameliorate the functioning of the immune system and reduce the co-infections and keep under good control the comorbidities. So in that point, apitherapy is a perfect tool for such a complex task, and it is cost-effective, well-tolerated, have less or no adverse reactions, and can be used in synergy with other natural therapies, with an integrative approach, so that apitherapy seems a perfect tool for this. This complex task can be realized only by using, ideally, on an individual basis. What do we mean by individual basis? One patient, one treatment protocol, but there are some general rules that we are going to talk in this session, but we have to keep in mind that it has to be organized on an individualized way. So what can apitherapy do here? As we know, we have the products such as honey, beeswax, bee pollen, royal jelly, propolis, bee venom. And we know that most of these products have antioxidant, antimicrobial, and immunomodulatory effects, so that these products are in the process of integration with the conventional medicine system, especially in the scope of preventive medicine. Today, the COVID-19 pandemic is spreading rapidly, and apitherapy has considerable potential to combat the pandemic. What can be the mechanism here in our fight when we are searching for a target treatment? Well, we know that enzymes such as PAK1 are targeted as a specific pathogenic kinase required for viral infection without harming the normal physiology of the hosts. So let's keep in mind PAK1. Again, we know that COVID-19 is an RNA virus from the corona family. And theoretically, COVID-19 infection can be predicted to be effectively treated with RNA polymerase enzyme inhibitors. And as third, coronavirus requires ACE2 receptor to enter the cell, and some of the drugs used in the treatment may block this receptor or related enzymes. So if these three mechanisms are effective, and if we are searching for a treatment from that perspective, let's see what we have in our hand. Well, we mentioned about PAK1 blockers, and there is a huge literature today that mentions the potential therapeutics against COVID-19 are PAK1 blockers. And we know that propolis, for example, is among the promising natural products with its ability to inhibit the pathogenic PAK1 enzyme, which has an important role in COVID-19 infection. So it's not only PAK1 enzyme issue, but propolis, for example, we said, is also an antimicrobial, and some of the flavonoids in it are especially antiviral agents. So it can play a role from the antiviral point of view. The affinity of some compounds in propolis content for ACE2 receptors is only one of the antiviral mechanisms of action, and the effect of some flavonoids in propolis on the basic protease enzyme that plays a role in the pathophysiology of COVID-19 infection has been demonstrated as well. So it seems that propolis, especially propolis, but not only propolis, has a very promising position and potential in our fight against COVID-19. Propolis and some other products, it has also been shown that they have powerful anti-inflammatory effect, and we need that effect as well. And it is known that propolis inhibits a synthesis of exosonoids such as prostaglandins and leukotrienes by preventing platelet aggregation, and inhibits the release of mediators that play a role in inflammation, such as histamine. And of course, the issue of antioxidants, it has long been shown that the free radical scavenging effect of antioxidant flavonoids contained in propolis and honey and bee pollen are very strong. And as one of the important issues that we know that apitherapy products have immunomodulatory effects. And we know that in COVID-19, the progress of the disease starts as a viral infection, but after a certain level, the problem becomes the reaction of the immune system, and we need a kind of immune modulatory agents to control this. So in that point, also apitherapy products have promising effects. Well, propolis, especially, we said there are many various literature about this issue. In one of these publications, it says, as you see, honeybee products such as honey, pollen, propolis, royal jelly, beeswax, and bee venom have shown potent antiviral activity against pathogens that cause severe respiratory syndromes, including those caused by human coronaviruses. So another one here, it shows the prospects of honey in fighting against COVID-19, and it has pharmacological insights and therapeutic promises according to this publication. It was interesting to hear the news from China in the early days of pandemics when they informed that in China the beekeepers are fighting against the pandemic more successfully. They sent a letter mentioning that a total of more than 5,000 beekeepers were surveyed, including the ones in Wuhan and the outbreak epicenter of Hubei. None of these beekeepers developed symptoms, have a series of symptoms associated with COVID-19, and their fight against COVID-19 were extraordinarily successful. Their purpose in writing this letter was to ask others with appropriate research conditions to test this assumption in the absence of vaccine at that time against COVID-19, if beekeeping can be effective, so that bee products can be effective. So they were informing the public about this situation. However, some of the other news, such as this one from Germany, didn't support what we heard from China. So they refused this approach from Germany. Well, as you see, there are many literature about, especially about propolis, the optimization and evaluation of propolis liposomes as a promising therapeutic approach for COVID-19. And also from Turkey, there were some publications supporting this potential. And not only preclinical literature studies, but there was maybe that can be one of the first clinical trials in Brazil. Andressa Barreta mentioned that first it was a review, and then they also made a clinical trial. And in this clinical trial, they used Brazilian green propolis as an adjunct treatment for hospitalized COVID-19 patients. That was a randomized controlled clinical trial. They used the standardized Brazilian green propolis in their study, and they found out propolis plus standard care support was associated with a reduction in length of hospital stay after randomization for treatment. You see here standard treatment alone, the patients stayed in the hospital 12 days, while if propolis was added 400 milligram per day, the stay became, the length of the hospital stay became meanly 7 days, and if it is 800 milligrams per day, it was 6 days. Yes. The time under oxygen support was also measured in that study in Brazil. The time under oxygen support, including invasive and non-invasive therapy, was not significantly different between the groups, but standard care alone was for 5 days, while if they added propolis 400 milligram per day, that became 3 days. And if it was 800 milligram per day propolis was added, then it was about 2 days. So that was an important clinical trial. And we also started in Turkey a similar study with water extract of propolis. And it is almost finished, and the results are quite interesting. That the ones who used propolis, water extract of propolis, the results were much better than the other groups. We haven't finished the statistics assessment, but it seems that the propolis group is doing much better. Well, with the aforementioned properties of apitherapy products, especially propolis, protective potential against COVID-19 infection can be predicted. Increasing scientific studies on apitherapy will play an important role in determining the view of physicians to the subject during the pandemic. So it seems that it has really important potential against in our fight against COVID-19, the apitherapy products, but we have to keep in mind that it has to be holistically and we have to approach from body, mind, soul perspective and support the people from the holistic perspective. Well, that was shortly I tried to mention about the scientific literature in a summary way, but I'm sure that Dr. Stangaciu and Dr. Andres will contribute to the issue and other colleagues. Thank you very much.
Thank you very much also, Dr. Timucin. Very nice presentation. Top scientist, yes, and yeah, now this was like I could continue with my practical things, but because I am, let's say, the organizer of the event, I must be very polite and friendly. So I'll put my presentation at the end of the conference. And now I would invite Dr. Andres Santiago Castillo from Ecuador. You can stop the share screen, Dr.
Okay.
Timucin. Yes.
Thank you very much. Thank you very
up,
much.
Yeah. Okay. Yes, very good. And before Dr. Andres Castillo will prepare his PowerPoint, maybe there are some questions for Dr. Timucin from the participants or any comments? Yes, it was before, the discussion between propolis tincture and water propolis extract. Before it was from Uruguay, one doctor who used a lot of propolis tincture. But it seems that you'll prove in Turkey that also water propolis extract can be effective. So
yes.
Okay. Let me. Okay. It's a bit of noise here. Any questions for Dr. Timucin? Raise the hand. I hear Professor Badiali-Ussi. Okay. Let me then thank you again. And then let me put here the mute all, and then we'll ask Dr. Castillo Montenegro to start his presentation. Okay. So, Dr. Castillo, please, the floor is yours.
Thank you very much, Dr. Stefan, for the invitation. Good morning here in Ecuador, and in your country, maybe afternoon. Salam alaikum, Dr. Ali Timucin. Thank you very much for everybody to stay here. I have a little time, just a little time to make this conference, and I prepare a little abstract, but very condensed to help all people who stay around the world looking for a new advices about coronavirus. And this is and my work could help everybody to get it. Thank you very much, Dr. Stefan. I'm going to share my screen. I have an Excel presentation. I hope that it will complete all your expectations. Okay. Well, I am making a lot of studies about coronavirus, and the first time 2 years ago to start this pandemic problem, I make a little compilation about statisticals about coronavirus. And this is the scientific evidence founded in the study groups of Quality Med Apitherapy Center in relation to the coronavirus pandemic. I have 3 groups, and one group is a control group. And it's very interesting, the average and percentage that I founded, because it means that many patients that we have in our Quality Medicine Apitherapy Center have interesting founds. For example, in group number 1, patients with who use Apitoxin average once a month, and before and during pandemic, and continue using Apitoxin at this time. Apitoxin in using LBs, injectables, and oral. Immunoglobulin G, 33% is positive in this group. Symptoms, 9%. Hospitalization, 3%. And long-term effects, 1%. It's very interesting that only have 1% of long-term effects. And about vaccination, 9% of these patients have these use vaccines, 2 doses of these vaccines. In number group, yes?
Excuse me, we cannot see your screen exactly, I think. Dr. Stefan, can you see the screen of Dr. Andres?
Yes, it's like 99% white, and then only the words comes now and then, like group 2.
Is here better?
Yes. Oh, yes. Yeah, this is
yes,
better.
now
better.
we can see.
Yes, okay. And then you can move the mouse, and then you can show us. Yes.
Okay. Thank you very much. I'm going to repeat. Group number 1, I have patients who use Apitoxin in average once a month before and during the pandemic. Until this time, they are using Apitoxin. They use LBs, injectables, and oral Apitoxin. In this group number 1, we have immunoglobulin G positive in 33%. Patients with symptoms, only 9%. Hospitalization in this group, 3%. Long-term effects, only 1%. It's very, very interesting. And persons who have the vaccination in 1 or 2 doses at this time in this group use 9%. Let's see group number 2. Patients who use all BHI products, includes all-time propolis before and during pandemic, and the average once a week at least. Let's see what happened. Immunoglobulin G plus 45% is more than the group number 1. Symptoms, 30% is more than 3 times of group number 1. Hospitalization, 3%. You can see that it's the same that in the group number 1. And long-term effects is the same like number 1, 1%. Only 1% of these patients have long-term effects. And vaccination is the same that the first group is 9%. Let's see with the control group, patients without apitherapy, patients that don't have any BHI products or Apitoxin or anything related to apitherapy. Immunoglobulin G plus 87%, symptoms 69%. You can compare with the group 1 and group 2, and it's very high, the difference. Hospitalization 21%, 7 times more than group 1 and group 2. Long-term effects, it's very explosive, it's 81%. It's very, very interesting. And this is the reason that I continue at this time making a new study that I'm going to explain after. Long-term effects, 81%. It's very, very interesting because we have a infection with coronavirus that it takes 2 weeks, 3 weeks, 1 month, or maybe 2 months in more of cases. But many people who had coronavirus continue with many symptoms and signs related after coronavirus. Coronavirus is negative at this time, but we continue with the problems in the persons, in the patients. This is the reason that I continue making the new study that I'm going to explain after. And vaccination in this group is 69%. Many people who have BHI products are very sure that are covered by BHI products. And patients who don't know anything about apitherapy look for vaccination like the unique way to control this kind of problem. And it's very incomprehensible for me because in diet, exercises, dogma, apitherapy products, and thinkings, we have the solution for coronavirus. Knowing the vaccination, but it's not common knowledge for many people around the world. Well, let's continue. This is the evidence group that this study was made by me 6 months ago. I end and make the cohort 6 months ago. And after I take this real value that is 81% of persons who have long-term effects in group control, yes. In group 2 is 1%, and in first group is 1%. This is the reason that I continue my work, and at this time I'm making this study. The objective of this investigation is to find the most signs and symptoms that appear after coronavirus infection and or the effects of vaccination. This is very, very important because vaccination in the group control, it was in 69%. And I am thinking that vaccination have long-term effects about coronavirus. My English is not very good, but I try to make my good effort. I hope that all the information that I'm giving in English gives to you new lights to continue treatment and using apitherapy to control coronavirus. Let's see what happened in the second part of my study that at this time is analytical study, and it is ongoing at this time. I don't have all the statistics at this time because I'm making this study, but it's very, very interesting and important that many people who are looking this video around the world use their BHI products to control and prevent coronavirus. Let's make an extract about this study. I am divided in 5 elements using traditional Chinese medicine, 5 elements and involve all the signs and symptoms, long-term symptoms that we have in patients who had coronavirus, and divided in first group in 5 elements. In 5 elements, I have angina pectoris, tachycardia, palpitations, and ageusia. It's about taste problems. It's not possible to get taste for these patients. I use like a first choice apitoxin, in second choice pollen, and I am studying tunia and tongue acupunctural points and normal acupunctural points, at this time is in study. The reason that I continue this study is because I need to make up my protocols to prevent and control long-term problems that we have with patients with coronavirus. And if we have these kind of problems related with the fire element, the first choice to control these problems is used to apitoxin, and the second choice is pollen. It doesn't mean that if not necessary to use another beehive products, but the first choice and the second choice and the acupunctural point that at this time is in study, maybe after a few months I give all the acupunctural points to use in each one problem. It's necessary to implement, to have good effects using beehive products in this kind of problems. Let's see in the next element, earth element, we have myalgias, anxiety, and fever, and problems with the control of the temperature of the body. In many persons who have these kind of problems, and the first choice in these patients, I use honey, and the second choice, apitoxin, acupunctural in study, the same. Let's see in the third group is metal element. We have dyspnea, coat, anosmia. In this kind of patients, I use in the first choice propolis and second choice honey, and at this time acupunctural points in study using apitoxin. In the next element, that is water element, problems with water element, I have arthralgias, amnesia, and vertigo. I use for first choice royal jelly and for second choice propolis. And for the last group is wood element. We have insomnia, depressions, and fatigue. And my first choice for treatment is pollen, and second choice royal jelly. I hope that all this information that I'm making at this time in Ecuador could be used for all persons who have interested in to use beehive products to prevent coronavirus and to help the long-term effects after coronavirus. That it is very, very interesting information that I found in my first study that at this time I am marking in yellow. 81% of patients who continue with problems after coronavirus infection, and maybe it's involucrated vaccination in these groups. Thank you very much for information. I think that I make a little abstract about my work, and thank you very much, Dr. Stangaciu, Dr. Timucin, to invite me to continue sharing my experiences. I hope after a few months continue making more lights about this kind of methods and continue working together in the head of the apitherapy of the world, Dr. Stangaciu and Dr. Timucin. Thank you very much.
Okay, thank you very much too, Dr. Timucin. Yes, it was very interesting to see the numbers of the people vaccinated, not vaccinated, apitherapy, no apitherapy. Very, very nice. Now, okay, in the classification of the disease and symptoms on the 5 elements, maybe can be some small changes there according to Chinese medicine, but basically it was very, very good, and the idea to use the bee products also was very good. Now, let me see if we have here, Dr. Ramona Jurcău is here. Can you, Ramona, if you are here, please activate your microphone just to be sure that you are here in the room. Can you hear us? Not yet. Okay, then if you have any questions to our first speakers in this section, to Dr. Timucin and Dr. Santiago Castillo. Now, it was one question, how did you use, Dr. Castillo, the bee venom, the apitoxin, in what form? Injection, cream, micro stings, what form? 3
forms, in leaf bee, injectables, and oral.
Injectables, oral?
And oral, yes. And a leaf bees.
Oh, live bees, yes.
Bee stings, bee stings.
Yes, yes. And the bee stings also micro stings.
Yes, micro stings all times.
Okay, okay. And the acupuncture points you choose, what were usually?
Not usually points. Each patient have your own points. And it's necessary to investigate each patient to choose the special points to each one. In the last study, in the second part of the study that I'm looking for acupunctural points, maybe I'm going to give a recommendation of a special point, for example, for angina pectoris. I pretend to use tongue acupunctural points, special points, especially in fits group 55, and it's maybe it's necessary to discover a new kind to use apitoxin in another ways, not be stings, making massage in the area of the tongue points using only fits. It is maybe in the future it will complete.
Okay, very, very good. Okay, so I will do my presentation because I see my colleagues, they are a bit delayed in the program. So I'll show some practical things about my experience with apitherapy against COVID. Let me share the screen, and I will start from this one. And let's see if you can confirm if you can see my full screen. Can you see the full screen? Make like this with the head.
Yes,
Yes, it's
we can
okay.
see.
It's okay. It's okay. Okay.
Yes.
Thank you very much. So I'll go pretty quickly through the slides as usually. This presentation will be also on online on YouTube, and I can also send you by email or by WeTransfer. I can send you this PowerPoint later. So if I go too quickly through some slides, when you see it in YouTube, for example, you can just stop the slide wherever you need, and you can see it. Okay. So some golden rules about to prevent and to treat COVID-19. First of all, find the weaknesses and eliminate them of the immune system, especially. Here are some of the causes of the direct causes of the immune system weaknesses, and each of them can make a lot of problems, and each of these causes must be treated with different systems. Like the coldness can be from outside, can be also internal coldness. Some people which are eating too much dairy products, too much milk or cheese, they'll have a kind of internal coldness. Or if they are too vegetarians, too like vegans, and they do not take enough soups, warm soups, or enough proteins which are increasing the heat in the body, they may get also coldness. And there are many other causes like the meridians, genetics, and so on and so on. And these kind of causes are not alone, unfortunately, in the case of diminishing the force of the immune system. So you see some more of these causes, like poor diet. If we do not have enough vitamin C, or we do not get vitamin D, exposure to sun, not enough magnesium, and so on, we may also get in trouble. And if regeneration is not good, the sleep is not in order, we have internal or external pollution. Like we can get very nice royal jelly, propolis, and so on, bivenom, but if the people have constipation, they cannot eliminate the toxins from the large intestine, from the liver, or they have kidney problems, they also cannot eliminate the toxins. So we need to do cleansing of the body. That's why in many cultures, many medical systems, the detox, it's like a kind of first step to do in almost all diseases. And many patients which are having problems, like the ones with comorbidities, the ones which are having obesity, diabetes, and so on, they are kind of having too many toxins inside the body. So you must make the cleansing, but as quickly as possible in this kind of disease. Okay, now the big problem is that these bad enemies, these are the bad enemies, they cooperate. And in order to, let's say, destroy the immune system. And if you look carefully, you'll see the poor diet affects the capillary fragility, it creates capillary fragility. Like if we have not enough vitamin C in our diet, or enough polyphenols, enough flavonoids, then the capillaries becomes too weak. And then it goes like this. So these causes, they are kind of badly cooperating and making problems more and more and more. So if you are doing in the treatment of COVID-19, if you want to sustain the immune system and you neutralize only some of the causes, like you neutralize the stress with psychotherapy, for example, or with homeopathy, it is fantastic. but you need to neutralize all other causes. If only one of the causes is there, like the lack of oxygen because of some pulmonary problems before, like asthma, bronchitis, and so on, or you have sleep disorders, this will affect also directly or indirectly the immune system. So you need to have a lot of patience. And then these are the, let's say, the direct causes. But when you look carefully and you look deeper, each of these causes have other causes. Okay, for example, the pathogen microorganisms, which are creating the co-infections. So you need to ask yourself, okay, why this patient has also Lyme disease, or it has a herpes, it has other microorganisms which are pathogens and they are bad. So how can I protect against these other microorganisms? Or I have dehydration. Is it because I do not drink enough water, or I drink enough water, but then I eat too many proteins, like meat or cheese or dairy products, or even vegetal proteins like beans or other kind of vegetal proteins. If it's too much content, then I get dehydration. So you need to neutralize all of these causes. And once you neutralize all these causes, the things will become much more clear. And you can make a treatment protocol very detailed and very highly specific to the needs of the patient. It is what we call in the recent years integrative medicine, but also personalized medicine. Okay, now very quickly, I'll go now to the other causes like capillary fragility. I told you this capillary fragility can be not only on the mouth near the teeth here, but can be present all over the body. So when somebody has capillary fragilities in the lungs or in the nose or in the large intestine or small intestine, then the virus, of course, will go easier into the system. And once it goes into the blood vessels, then it can cause many problems. Okay, so one of the causes of this capillary fragilities is it goes here to the parodontosis, periodontitis parodontosis, because of the mistakes of the diet. For example, these young people, they are drinking too much Coca-Cola, too much Coke, Pepsi, and too much sugar beverages. This affects, of course, their teeth. They lose the teeth because the gums are attacked by the sugar. Sugar is a bad enemy. Okay, so once we have this capillary fragility, everything goes very bad. And we can block, as I said, the capillary fragility, not with antibiotics, with cortisone, non-steroidal drugs, antivirus, lung ventilators. These kind of methods will never solve the problem of the capillary fragility. So you need to go to other methods like BHI products, as you use a lot, like this kind of polyphenols I told you, and vitamin C is very important. Now, rule number 3, avoid the co-infections or treat them. And there are many kind of co-infections. We forget about them. Now we focus on SARS-CoV-2, but there are many people having a lot of other infections in the body. They don't know about them. Maybe they are parasitic. Some people, parasites inside the digestive system and so on and so on. Or like herpes virus, which can stay to many people inside the body and cause also a lowering of the immune system. So we know from the literature, scientific literature, if you look, there are hundreds of studies which shows that the bee products can destroy the bacteria, even the bacteria which are resistant to antibiotics, like it happens with the nosocomial infections in many hospitals nowadays. They can be destroyed by honey, by propolis, by essential oils, and so on. So here, rule number 4, we should use everything we can to prevent and treat the comorbidities, because as Dr. Timucin showed also, and also all our colleagues showed, the people are dying mainly because they have these comorbidities. It's clear. Like we have had some statistics here in Romania, from 280 people which died because of COVID, 273 have had comorbidities. So this is the real cause of this problem of the COVID-19, and we must treat these comorbidities. And again, there are tons of scientific literature which shows that the bee products are good for all cells in our body. It's like Dr. Santiago Castillo showed, bee pollen is very good for the liver, for regeneration, bee venom for the cardiovascular system and nervous system, propolis for immune system, for the lungs, honey, excellent source of energy for all the cells in the body. Royal jelly is very good for regeneration of the cells and a good clean division of the cells. Now, another rule, very important, is to use multiple weapons, not only one molecule. This is a huge mistake made by the pharma industry in treating COVID and in treating many other diseases. It is very practical and very profitable to make only one molecule based medicines. They may work in emergencies, in some emergencies like infarct, heart attack, and so on. But in a very complicated disease like COVID-19, only one molecule is not the solution. So it's like here we can put in comparison, antibiotic is one molecule, and the bee products, huge number of different molecules, like over 5,000 substances. Some researchers are saying that we can find in the bee products. And these classes of substances, they cooperate together in a good synergy. It's not like before the bad enemies, they are cooperating together. Here is the good friends, which are cooperating together. So we know aromatic substances are very good antiviral, antibacterial, antimycotic, flavonoids, antioxidants. Vitamins helps a lot of enzymes and the genes in our body, vitamin D, C, and so on. The acids, they improve the fluidity of the blood. The minerals helps the immune system together with the trace elements. We know that the white blood cells, they need certain kind of minerals to be active. And if you can go like this to all of these categories, we need all of these categories, like the amino acids. Now the pharma industry says vaccines, vaccines, vaccines. Okay, I can accept that. But if you look to how the vaccines are working, they stimulate the B lymphocytes to produce antibodies, but the antibodies are made essentially by amino acids. So if a patient has not enough good amino acids, good quality amino acids, including the essential amino acids, they cannot produce the antibodies. So the vaccine is useless. So we need to have an integrative thinking and to take all these kind of substances together to have a synergy. Now, rule number 6, more friends than allies are always better in the fight against an enemy. So we need friends and allies. And here can be, like we know very well from traditional Chinese medicine, from Ayurveda, we should use always to our patients, when we do integrative medicine, we need to use also phytotherapy, like herbal medicine. We need to use this kind of exercises like Tai Chi here, at least to prevent the COVID. Of course, when the disease is advanced, severe phase, you cannot do any more this, but you can prevent COVID with meditation, with Tai Chi, and with a very healthy diet. And of course, by using appropriately with the help of a specialist in acupuncture, the acupuncture points. Now, here is another very important thing is that we need to make happy all the living cells in the body in order to make the body function properly, including the immune system. And now let's focus a bit on the immune system cells. If you look in the blood, these are the cells which are working in the blood. But before these cells are coming to the blood, they have their ancestors, their father, mothers, parents, and so on. The ancestors are here, and the ancestor of the ancestors is here, this hematopoietic stem cell. And this one is made in the red bone marrow. So if the red bone marrow does not receive enough oxygen, enough good blood, good quality blood, clean, with enough nutrients and enough protective substances, from the very beginning, this stem cell will be kind of intoxicated, will not work properly. So all these lines of cells cannot be very strong. So at the end, I have this kind of substances here, this kind of like B lymphocytes, the T lymphocytes, which are extremely important in the fight against COVID, but they'll be weak. They will not resist in the fight against the virus. So we need always to take care to who are the ancestors of the cells, these stem cells. We must protect them by all means. And here it's a model I presented to many, many conferences, courses. It's my thinking model. When I have a patient, I always put this kind of model in my mind, in front of my eyes. And I put here inside, in the middle, the cell or the tissue or the system, like the immune system. And then I'm asking the patient, how is your nutrition? How is your structure? Do you have any genetical structure problems? Can you get enough oxygen through your nose and the bronchus and lungs? Is the air in your area clean air? Do you have enough protection? Are you an ordered person, disciplined person? And so on and so on and so on. So all these categories are very, very important. Like if you do not have enough sleep, good quality sleep, you can take 1 ton of honey and propolis. You'll not be most probably healed fast of COVID. You need much longer time, or you'll not get healed. So all these categories, communication, information, energy, even love. So you cannot say maybe love at the cellular level, but even the cells may feel the love if we receive the love from our people around us or from our own love inside. Now, here is the use of this concept of yin and yang, the concept of 5 elements. And we have, when we put these B products according to the 5 elements in traditional Chinese medicine, this is also, it's just a thinking model. It's a memory kind of model. So it helps us not to forget in our treatment protocols to use some of these products when you have in mind this 5 elements theory. And rule number 8, we should administer the products through all anatomical ways and not only through the mouth. So it's good to administer through the mouth. Like it said before, Dr. Amelia Torpisano from Uruguay. But she mentioned also that she, in case of severe cases, she uses also respiratory way, like inhaling the substance from the beehive and inhaling the substances from propolis or honey directly through nebulization or inhalations and so on. So we need to use all anatomical ways. Practically, we need to have honey all over the body because honey gives energy to the immune system, to all cells in the body. We need to have all the body propolized because you need to block all those ACE2 receptors. And we need to fight the virus wherever they are. So you cannot have propolis only in the nose or only in the lungs. You need to have propolis everywhere. And that's why you need to use all anatomical ways, including suppositories and so on and so on. Okay. Now, some ways to get the honey and propolis, very, very practical nebulization. You find nebulizers in every pharmacy. And also one very interesting method I learned from some of our friends in the internet, even honey intranasal. So if you just use honey intranasal, it can activate the blood flow here. And also it can activate the production of a fluid mucus. And also it gives energy to the local macrophages. We know that under the skin, under the mucosa, are these immune system cells, macrophages. And when they get honey, they get more power. So of course, they will be more powerful against the virus. Then propolizing the air through the body through breathing masks, like this Propolair from Italy. We can use it very practically. You have some heat here created especially by this device exactly at 82 degrees Celsius. And then at this temperature, the propolis at 82 degrees Celsius becomes liquid and starts to evaporate very easy volatile substances, which we can then inhale. And then also you can put in, and it's a very good idea to put it into your bedroom or even into the living room, enough such devices to propolize the air. And when you travel by car, you can put it in your car. It works wonderful. I tested myself several times. It's just fantastic because in the car you have a small room, small amount of air, and then the propolis from here will propolize much faster the air in the car. Now, Propostil, it's another device from Slovenia. You can put directly the raw propolis. Here, the Italian system, you need a special propolis, which is refined and cleaned by Italian people. But here you can use your own propolis, of course, a good quality propolis, and it will propolize the room also very fast. Attention that this metal thing should go to 82 degrees Celsius. The first products, the first devices, it was a technical error, and they heated the propolis to 260 degrees Celsius. This was discovered by one of our friends from Germany. And when the propolis is heated over 100, 120 degrees Celsius, can become toxic. So attention to check the temperature of this plate. Okay. Okay, bedroom. Now a few words about the beekeepers. We know that they are much better protected against COVID. We spoke with friends from all over the world, people which are having, like they are coordinators of beekeeping in many countries. And the number of beekeepers which are getting COVID is really very, very low. Of course, we need to make a very detailed statistical analysis and speak with all these beekeepers, maybe through Apimondia, through our federation. But basically, the beekeepers are surely better protected against the COVID-19. And here are some acupuncture points which we can stimulate with a bee venom, like bee venom cream, or micro bee stings, or injections in some cases, or because these 2 points are very good for the lungs. And also we can use some other points here in the center of this thorax. It's a conceptual vessel 17, sorry, it's here. This one is also good for the lungs. And there is this area for the thymus. Thymus, it's located in this area under the sternum. So you can put also a cream, bee venom cream in these areas. And these other 2 points here, 25 and 26, they are bronchodilatory. They are very, very important because we know in COVID-19, the lungs are getting too much wetness, too much water inside, too much mucus. So the air has a problem penetrating, but if you have something which can dilate the bronchia, it's better. So these 2 points, the tip of the nose and this one, very good. Then here on the neck, on the dorsal part of the neck, this also is very good. This one I told you before. And this one is also good against the laryngeal spasm. It's also very good in such situations. And then these are urinary bladder 52, GC. This is very, very important because this stimulates, it helps the functioning of the adrenal glands. The adrenal glands are located here nearby on top of the kidneys. And we need adrenal glands strong in such a disease. At this point 2 for the lungs. Micro points. There are micro points also on the ears. The lung area is here on this part of the ear. And it's another very good method is to put just bee venom cream on the ears, all of this area, and just make the ears very, very red, very, very hot. And practically when you do this, like make massage on the ears, and then you can make also some acupressure with the fingers or micro acupressure, then you can stimulate practically about 500 acupuncture points. Okay, now one other administration of the bee products, especially royal jelly, is very, very good under the tongue. So use all anatomical ways, as I told you. We have in Romania already royal jelly in syringes form. And also this one, it's one of the best possible kind of preservation of royal jelly directly in the queen cell and protected by the honey and protected by the glass. And if the glass is dark color, it's even better because it protects against the ultraviolets. Okay, so then we need to use all kinds of foods which are having organic acids, because these organic acids, they improve the blood flow, the fluidity of the blood. And once we have the good fluidity of the blood, then we can avoid the making of the thrombosis and blood coagulation and so on and so on. Now, a few words about the role of heat and fever in the prevention of the treatment of COVID-19. Unfortunately, we see that many doctors, many patients, the first sign of subfebrility, like the temperature goes a bit high, like maybe 38 degrees Celsius, they get in panic and they start to use drugs, which are chemical drugs, like paracetamol, to diminish this fever. And of course, when the fever is very strong, it can destroy also the green grass, like in this image here. But the fever is very good to destroy the dried woods here. So it helps the immune system and all the cells in the body to get rid of the toxins of the dead cells and so on. So fever is usually our friend, not our enemy. And we can speak a lot about this topic, but just only one important argument here. It was published. I advise all of you to check this article made in 2015, in June 2015. It was a review on the role of fever all over all kind of animals, humans, even fish, birds, all mammals. When they have an infection, they get fever. So this is the natural method of the life of the bodies to fight the infections by increasing the temperature inside, because once you increase the temperature, you get a lot of good advantages. So this article said that if you decrease the fever too soon, you will increase the risk of death. So attention, we should never diminish the fever too soon. We should allow the fever to work in the body, and we should, here you have this article again, which shows that the fever to decrease too soon increase the number of fatalities. So if we need to really decrease the fever, we should do it only physically, not chemically, with chemical drugs. Like we just put some water on the forehead, we take out the clothes, we drink some room temperature water, and so on and so on. Now, another use of a bee product to increase the heat in the body, especially in the first part of COVID, it's to use this system like we saw in China 2 years ago. It's a system you put propolis and beeswax, the special preparation, and then you can come with this kind of device which has a connection to electricity. And then this one is heated to 55, 56 degrees Celsius. And the heat goes very deep, slowly, very deep in the body, here including in the lungs. And it helps the lungs to fight the viruses, the bacteria, and so on and so on. So only when it's really very advanced, it's like a huge inflammation, then we should not use such method. We should use other methods. Okay, good. So beeswax, good for the heat. And now here a few words about the API protocol. I'll go quickly. Just we need to use propolis through all anatomical ways, as I told you. And honey also through all anatomical ways. Okay, then bee venom we can use as a cream, as microsteams, orally as tablets to sustain the whole body on acupuncture points. We can use also here as conclusions. Now I'm coming to the end of the presentation, to the conclusions. Prevention is always better than cure or treatment. It's logical. And the doses of the beehive products we saw from many other colleagues in this conference should be as high as possible. One of the reasons, because with the bee products, we have a huge advantage. We have no problems with high doses. We can take even 500 grams of honey in 1 hour. If it's enough water, we drink enough water. And also propolis can go up to 70 grams per day in raw form, and it's no problem, it's no toxicity. Same goes for the other products. Of course, we should not have allergies or intolerances to these products. And always use all the other methods: apitherapy, phytotherapy, aromatherapy, nutrition, psychotherapy, Ayurveda, and traditional Chinese medicine. And we thank you very, very much. This was the presentation we did together with Dr. Timucin in Australia and Bosnia and Herzegovina. Please join our International Federation of Apitherapy. We have the president, Dr. Ali Timucin, and our vice president is the president of Latin Federation of Apitherapy in South America, is Dr. Andres Castillo Montenegro. So just see this website and join us. Okay. Okay, thank you very, very much for your attention. I hope my other colleagues are already here. Yes, I see Ramona Jurko here.
Yes, hello.
Yes, very good. And I propose we go to the next speaker, and maybe at the end we make all the discussions and free discussions to discuss specific points. So Ramona, if you can share your screen.
Hello, everyone. Yes, I apologize for some moments ago. unfortunately, I think that the moon eclipse is working. Of course, I'm joking. I am into the devices, also in phone and in the computer, because the computer has no sound. So I will do the share screen. Please tell me if you can see. I think I cannot share the screen.
Not yet.
Yes.
Ok. Să deschizi întâi PowerPoint-ul, să-l pui la 100% mărime și după aia să dai pe share screen și să dai OK. Okay.
Screen host disabled. Attend screen.
Sorry, Ramona. It's my mistake. My mistake. I forgot to put you co-host. Yes. Sorry. Now it should work. Okay, try again, please.
Okay. It's still the same information.
No, you are co-host. You are co-host. Oh, no. Yeah. You are co-host. I put it as co-host. Let me check also here.
Okay.
The participants. Yes. So maybe because you are on the other, you are here with the phone. Your PowerPoint is on your computer?
Yes.
Okay. And is your computer connected to our platform through the?
Of course, I see you also in my computer.
Okay.
Just that it said the same thing that I'm not able to share screen.
Oh, it's funny. Okay, let me take the co-host from some of our colleagues, and maybe you will be better now. Okay, let's try now. I'll make you host. Okay, just host, full host. Okay, try now. Oh.
I'm not sure. Maybe now. Well, it's the same thing. Stefan, maybe if I will send you the presentation, will be okay.
Okay. Yes. Send it to me by.
I don't know why it's telling me exactly the same thing.
Okay. Okay.
I don't understand.
Okay. Okay, I don't see Charlie here. Send me just by email. Send me the presentation, Ramona, and then until I receive this your PowerPoint, we can start the discussions among us about the protocols. Any questions you have, or maybe also if you have some recipes, some practical things from your personal experience, just share them with us. Okay, so who would like to start? I would ask David Sauver from France. Quelle est votre expérience, David, en France avec le Covid? Quels produits utilisez-vous?
Oui, je ne sais pas si vous m'entendez.
Oui,
d'accord. Tout d'abord, Stéphane et tous les intervenants, je vous remercie parce que ça a été une journée vraiment passionnante. Donc, pour vous répondre, les produits qu'on utilise sur le traitement de la Covid, c'est plutôt effectivement la propolis et la gelée royale pour leurs différentes propriétés. Donc, là, j'ai beaucoup appris aujourd'hui des différents intervenants sur notamment les dosages et les modes d'administration. Donc, voilà, c'était vraiment très, très intéressant et encore merci.
Okay. Merci beaucoup aussi, David. So David said he's from France.
Can
He
I
said
speak
he's
a little
using...
bit, Stefan, because speaking from another point of view, like an emergency doctor, because
Okay,
you said something
okay,
about fever, and I would like to make some mention, if it is
okay.
possible.
Yes, of course, Michaela.
So,
Let me finish
yeah.
the translation from David, because he's
Yeah,
spoken in
okay,
French,
okay.
and our colleagues, they do not understand French. So David said that in France, they are using a lot of propolis and royal jelly. So he personally used a lot of propolis and royal jelly, and he thanked for our conference. Okay, yes, Michaela, now please speak about your point of view about the 5 elements and the B products and
About the fever, because
okay.
it's very much to discuss connected to COVID-19, but especially I want to make a little discussion about fever, because here, speaking about fever, we have 2 types of patients. And this is very important to know. First of all, there are patients which you are knowing, yes? You are treating them for a time, you are knowing their comorbidities, you are knowing how to deal with their fever. This is the first group. And here you can a little bit trying to not give them from the beginning the allopathic drugs, I agree. But there is a second group which are coming or are asking for help because they are having COVID and they are having high fever. High fever means also a big inflammation. And I must tell you that I had patients which after 3 days, they didn't have any more fever, but they are having at least 40–50% of lung infection. And then it is very important to know how to deal. Are we giving allopathic drugs or we are not giving? Are we giving anti-thermic drug or not? Speaking only about COVID, we have to know that allopathic drug like paracetamol is very important because it's dealing with inflammation, and it's better to give, from my point of view, to give propolis big amounts, but if you have high fever, and this means also 38 degrees, it is important to give also allopathic drug, because I'm working like an emergency doctor, and that is why I'm telling, because you don't know the vital force of the patient, and then it is very important to know how to deal with the fever. Thank you very much.
No se escucha, Stefan.
Not hearing.
Not hearing, Stefan.
Yes. Thank you very much, Michaela, for your input. Very interesting. Yes, when the patient has really high fever, of course, we must diminish it as quickly as possible. In the hospital environment, it's difficult to diminish with physical methods because the doctors, they are using just very quickly paracetamol and these kind of things. But in the home level, and when the disease, at the beginning of the disease or first parts of the disease, then we can use, I believe, all these kind of methods. But I agree with you, if the fever is very high, it may be also big inflammation. But think also in the case of children, they develop very high fever. And this is also because their immune system works very fast. And it's not only always like big destruction. It's just the virus there or the bacteria.
Stefan, I prefer to the children to combine.
Yes, very good.
Because you know very well how often, if you don't know the patient, it is very important to know, it can degrade very quickly. I had some patients which they had fever. It doesn't matter, children or adults. Only 3 days they had fever, but their oxygen saturation decreased after 4 or 5 days, and they had 88 or 89 or 90% the saturation of the oxygen, and they went immediately to the hospital, and they had almost 40 or 50% affection of the lung. So I think it is very important to make a differentiation between the two groups of the patients. You know them or you don't know them. If you are knowing them, and then you can a little bit accept not to give them allopathic drugs. But if you don't know them, then it is a little bit difficult to sustain only with the natural treatments. This is my opinion, because I had a lot of patients, and I saw a lot of patients only, and also in the emergency room, and I could see them also in my practice. And then I could make a conclusion how you can deal with this type of treatment, which is COVID-19. Thank you.
Okay, thank you very much, so Mihaela. I saw a sign from Claudette Renal. If you can activate your microphone, Claudette.
Oui.
Yes.
Bonsoir.
Oui. Bonsoir, bonsoir.
Merci à tous les intervenants pour leurs très belles interventions. Merci beaucoup. Par rapport au Covid-19, j'ajouterais à ce qu'a dit mon collègue français tout à l'heure, par rapport à la propolis, j'ajouterais aussi de la propolis brute dans la bouche pour maintenir une barrière anti-infectieuse au niveau de la bouche. Et j'ajouterais aussi des enveloppements de miel sur la poitrine, cataplasme, enveloppement. Tu comprends, Stéphane?
Oui, oui.
De miel sur la poitrine, du miel d'eucalyptus, par exemple, sur lequel on peut mettre des gouttes de teinture de propolis, et sur laquelle on peut mettre aussi des huiles essentielles, essentielles antivirales, comme le tea tree, ravinsara, etc. Voilà pour les produits de la ruche. Et j'ajouterais aussi la vitamine D à prendre tous les jours, la vitamine C à prendre aussi tous les jours, et le zinc, faire des cures de zinc. Et en particulièrement au moment des fortes épidémies, et si on est malade, Echinacea angustifolia en gouttes. Voilà, je crois que c'est bien comme ça.
Ok, très très bien. Merci beaucoup, Claudette. Je vais traduire en anglais. Okay, so Claudette Renal Cartabas, she's our very good friend from France. And she said that in her practice, in her experience, personal experience with the friends, she's advising them to take also propolis, raw propolis, just to keep it in the mouth, like for like 30 minutes, 1 hour, just chew it a bit, and then maybe you chew it before you swallow with some pollen and some nuts. And this will protect the mouth against the virus, because sometimes the virus comes also into the mouth. And also she said, it's another application of honey, very interesting. Few people are thinking to this. COVID-19 attacks the lungs, but we have here the access to the lungs, let's say through the acupuncture points on the chest here. And there is one method also used a lot in Germany in the past. Just put honey on the thorax. Put a lot of honey here on the chest, here, honey, maybe 50 grams, 100 grams. In Germany, they say 500 grams. You can put it and you cover it, and the honey will come into the skin. It will be absorbed quick, slowly during the night, and it will help the immune system here locally, the macrophages and so on. It's a topical local treatment. Okay, and also she said that we should put also in this honey some propolis tincture and also some essential oils. We know when you have essential oils diluted in enough honey, like you have 1 drop of essential oil for 5 grams of honey, it's a good enough dilution, so the essential oils will not be too aggressive to the skin. And also, like all of us, we know that we need to use vitamin D, C, zinc, supplements, and also Echinacea. she used echinacea in drops like tincture of echinacea to improve the immune system. Okay, thank you very much, Claudette. Now I have the presentation of Dr. Ramona Jurcău. I will make the share screen and she will tell me when to continue, like next. And so we'll see, she has an approach. She says that we need to have, okay, moment. Okay, here should be this one. It's an approach. We know that in COVID-19, all the patients are extremely stressed, and we need to keep under control this stress. And there are some methods to keep it under control. And Dr. Jurcău, Ramona Jurcău, who works in a university in Romania, she will present about this. Give me a few more seconds. Okay, so now share screen. Oh, host disabled participation. Now I gave you Ramona, dacă poți să intri aici la participanți, că te-am pus pe tine host și pune-mă înapoi pe mine host, că nu pot să fac prezentarea. Intră aici la participanți unde e numele tău, în dreapta acolo unde este more. Așa, dacă te găsești. Aici, da, sus. Și acolo la more, anulează partea cu host, dacă poți să o anulezi. Dacă nu, atunci...
Nu apare partea de host.
Nu-ți apare. Atunci du-te la mine unde este Dr. Ștefan Stangaciu, un pic mai sus, și în zona apasă pe more și fă-mă pe mine la loc host.
Voi încerca de pe telefon să văd dacă mi este.
Ok. De pe calculator nu poți?
Nu.
It's a big problem. Then încearcă de pe calculator.
Te-am pus co-host.
Așa, bravo, bravo. Dacă m-ai pus co-host, atunci este ok. Bravo. Ia să încerc să văd dacă pot să fac acum share screen. Ok. Yes, I can do the share screen. Yes. Okay. So
finally,
yeah.
Thank you so
Yes.
much, Stefan.
Okay.
I apologize. One
Okay.
more thing. So the presentation has more slides, but I will do a synthesis. If you will need the information, I can offer you with all my pleasure. We decided to this subject because, you know, our emotion can change a lot in terms of our health. I have preparation in medicine and also in psychology. My sister also the same. And for this reason, we were also interested in this point of view. More than this, because of my preparation in homeopathy, which is something between the worlds, because it's related a lot with psychology, but it's related also with medicine. We can see that the psychological level is very important during this time. So please, next, Stefan. Here we have a very short content to know what it's about in the next slides. Yes. Stress is so very close to us, unfortunately, more than other periods in our life because of the impact that this pandemic has in all our levels of health. So for this reason, please, Stefan, we decided to take one of the adaptogens from the group of adaptogen, of the classical adaptogen, ginseng, to show some very nice information. There are no from 1,000 years, but in the last decades, they are more improved in research. The next, please. There are, regarding the types of ginseng, we know some of them. We know the fresh ginseng, that is the natural one. The white one, which is simply dried, and the most rich in benefits, that is the red ginseng. The most important is the Korean red ginseng, which is also dried, but it is also treated at a high temperature, as you can see in the right picture. Next, please. Korean red ginseng, as I said before, has high biological effects, a lot of benefits for the body. You can see they're mentioned. Next, please. In terms of research in generally, we can find a huge number of research regarding ginseng. We can see that from the beginning of the first publication till the last that is now put it from the next year, for the next year, we have a lot of research also in men, also in female, also in the both genders. And we have a lot of reviews, of systematic reviews, but less clinical trial and controlled clinical trial. Next, please. Here I wanted to show you a very nice, a very interesting image from a review some years ago that showed the importance of ginseng as a dietary supplement, as an immunomodulator in various diseases. Because now, nowadays, now from almost 2 years, we are talking about immunity, we are talking about vaccine, we are talking about things related to oxidative or mechanism related to oxidative stress. And here you can see that what you have surrounded in pink, that ginseng has very good influence in protection in infection diseases and also in vaccinated people. Next, please. Also, as a summary of pharmacological activity, we can see a very important antioxidant, anti-inflammatory protection in cardiovascular and nervous system, central nervous system. The last two very involved in everything it was related in this period of pandemia. Next, please. Here is a very nice and very complex diagram that shows the effects of ginseng on the brain. Because we saw these last 2 years important problems increased in terms of neurology. Stefan presented one experience that is regarding to his own experience, and the fact that using ginseng people can have higher neuroprotection and antioxidant protection, it's very important. Also anti-inflammatory. Here we can see the complexity of mechanisms that can be involved. Next, please. And we have here an example of American ginseng, one of the most known and used in the world. And I surrounded anxiety because we put the accent in this presentation more on the stress and on the psychological. The other effects, of course, they are very useful in this period of time because the echo of the mechanisms are all over the body in totally.
sorry. Sorry a bit, Ramona. I just mute all because it was some noise. I come back. Okay. Yes, you can see now. Okay. Please continue. Can you see the screen now?
Yes, we can.
Yes. Okay. Ramona, can you hear
muted.
us? Oh, she's muted. Okay. Wait a second. Ramona, can you should unmute yourself. So you have the microphone. Activate your microphone, Ramona. Yes.
Okay. Sorry.
Yes. Now, okay. So now I'll make again the share screen, and we come back. I'm sorry, some people they make too much noise. Okay, now you can see the screen. Please
No
continue.
problem. Yes. So the next one, the next slide.
Yes.
Yes, after the picture. Here, just for show some examples of clinical trials related with placebo, we can see, for instance, in physical effort in healthy people. Why we choose this example? Because sports suffer a lot this period of time. People couldn't go to the normal gym areas, or well, for the athletes, professional or non-professional, it was a hard period of time. So ginseng may increase the maximum oxygen consumption and can increase also endurance. And in terms of education, of learning, which is another level, very, very touch all over the world, increase memory, performance, and mood. Why it's so important, mood? Because staying home, learning alone, not being surrounded by colleagues or the atmosphere, that it's important for learning in groups, because for this reason we have schools, isn't it? It doesn't matter the level of education. Affected a lot the mood. So not only in terms of memory for the nervous system, but also in terms of mood and quality of life, using ginseng is a very good help. Ginseng related to placebo showed that researchers showed that they have a lot of good improvement in somatic system symptoms, in sexual function, that also was under spot in this period of time, even not so in the first line, but still there were problems in this direction. Sleep quality, which was very affected in this time because of the psychological level, which was decreased in this period of time, and also the performance in sport. Next, please. Yes, related to stress, in terms of psychological stress, in terms of chest frame of the stress. There are a lot of research that show that ginseng is an excellent anti-stress resource of source of nature. Can improve disorders in hypothalamic pituitary adrenal axis, improve memory, relieves anxiety, and also has a huge impact on mood disorders and depression, diminish a lot of depression. So it's a very good antidepressive remedy. We can continue. Also, ginseng can prevent the stress-induced diseases because stress can have, unfortunately, a lot of side effects. For example, neurodegenerative conditions or inflammatory disease, and also oxidative stress, which can be modulated in a very benefic way by ginseng. We can continue. The main component of ginseng are ginsennoids. There are more than 100 different categories. Here in the picture, you have 2 examples of ginsennoid, the most known, and research of them. With a lot of pharmacological effects, protection for cells and against cells death and damage, in immunological and metabolic disease, and a lot of improvement in the nervous system. You can see in a different direction related to nervous system. We can go on. Here we can have some examples of stimulation and protection in antioxidant terms. You can see that ginsennoids can stimulate, for instance, superoxide dismutase, and can stimulate also the endothelial nitric oxide synthetase. And so we have the very profound examples of mechanism related to their action. We can continue. Related to human cognition, which is also one of the main points of this period, we can see that administration of ginseng can improve cognition, and also red ginseng has a very, very profound effect in oxidative stress inhibition related to the brain structure that are involved in cognitive functions. And so in the end can have very useful use in delay of aging process. Yes. Related to our personal experience, we had some researches. We put it here, some of them. We presented international conference in endocrinology and metabolism. One of them, yes, the title is on the next slide. Yes, the influence of Romanian product ginseng on mental fatigue and stress model. Yes, and here in the next slide you can find the results that we had. Yes, Stefan. Well, we had research on mental stress, which means learning in a short time the Korean alphabet. It's not very difficult to learn, but still it's something particular. And to say some basic words as a basic conversation. And we use this extract in control 1 week and 3 weeks of treatment with this product. Of course, we expected to have these results on anxiety, salivary alpha amylase, which is one of the most important markers of the psychological stress, and in fatigue. Yes, ginseng showed that we can obtain an improvement of the quality. I mean, it's a very good antioxidant, and protector against stress, and diminish the fatigue. When the doses was 3 weeks, well, the improvement was better. Another example, it's a comparison between Panas ginseng product and Donquai product, which is Angelica sinensis in Latin name, in its Latin name. And we had four groups: control, placebo, Panas ginseng, and Donquai product. We examined anxiety, heart rate, and glycemia. Why glycemia? Because sugar blood increase in stress. We know that soft insulin, all the other hormones are increasing glycemia. So in stress, generally, we have this effect. Yes, we can go on. And here you can see the comparison. We evaluate the parameters before administration, before the stress in T2, and after the stress in T3 and T4. We obtain significant differences between the groups. Here in the last picture with the red and the green flash, you have the ginseng and the Donquai group. There were little differences in some cases, but still significant also between the two. And in conclusion, the treatment with Panas ginseng was more improved more the stress protection than the Angelica sinensis product. The next one, there is another research. This one is a short review, comparison between some adaptogens, Eleuterococcus, Schisandra chinensis, Rhodiola rosea, and ginseng. Here we had in different colors the effects. We were interested almost in sport related to stress, and generally all of them improve sport activity, endurance, have a very good antioxidant effect. And it's very interesting here on the last part of the text, you can see the ADAPT 232. It's a product that contains 3 of these adaptogens. It was used by Russians to have a stronger effect in terms of adapt body and physically and psychologically to stress. In our practice, because this is the most important, in this year, we try to combine the practice and research in the meantime. It was not very easy, but in these 2 years, we had some results. And because we use also bee products, we try to see also, of course, related to the agreement of the patient, because some of them wanted one protocol or the others. We choose related to their wish also. Improvement in anxiety, for instance, in depression, if we used only Korean red ginseng at 2 grams per day, the improvement of depression was better. We collaborated with psychiatric colleagues and psychologists also, psychotherapists. We combine also with tulang honey, because it's shown in literature that also acacia honey, they have a good improvement in depression. They have very good antidepressive effects, and together with ginseng, the effect was better every time we had evaluation for anxiety, for depression. Next, please. Also for memory, because memory is very important in terms of learning, of education, and not only in these terms, but also for old people that suffer a lot in this period of time because they were more isolated maybe than the other ages. So also in oxidative stress, we had very good results when we combine honey with Korean ginseng. Yes, and yes, I don't know if you have another part, Stefan.
No, okay, no, it's only this one.
Okay, so I will tell because I think that is not put it here. I will tell some words just to make a conclusion about another practice that another source of nature that we use a lot in this period of time. And for the person that will be interested, I can send them material in this direction, and also will be as an abstract in, of this conference. Related to the olive leaves extract, we when I tell we, I speak about me and the colleagues in the team I am belonging. Now I think that maybe it's this one. You can try.
Yes, yes, yes.
I'm not really sure. There are some slides only.
Okay, so like we are a bit delayed. So can you do it in 3 minutes?
Yes, of course.
Okay.
I'm not sure. I think that it's this one. If you can. Yes. So I wanted to put under the spot some ideas. Maybe not all our colleagues are very close to this subject. The olive leaves extract, it's very useful. I didn't know about this. I have to recognize till some 2-3 years ago. But from that moment, it's part of my life. I indicated them as a treatment in usual in daily life. Because if you will be curious, you will see that olive leaf extract has a very important modulator effect in human response. Next, please, Stefan. A lot of improvement in terms of defense, also in T lymphocytes and also in B lymphocytes, and has a very important therapeutic effect in acute and also in chronic inflammatory disease. We can continue. It was shown that it has a very important effect in HIV infection. We can continue, and we know that there is some relation in terms of structure between this virus and this one from 2 years already in the world. And in terms of HIV infection, it was shown that has a very strong effect in defense in terms of protection against this virus. We can continue. Also, the olive leaf extract has the one that we used more than 360 compounds from these compounds, more important is hydroxytyrosol, oleuropein, and other compounds, rutin, for instance, that are shown to have also improvements in terms of psychological and physical effects. Here you have the research regarding this particular extract that I'm talking about. It's produced by an Italian company, and the certificates that show that it's qualified as a very useful product. Particularly, we use it before this pandemic in a usual quantity of 70 or 100 milliliter per day. But during this period of time, because the immune system was very touched, because the psychological level was very touched, and because it was shown that olive leaf extracts have has a very good effect in anxiety and depression too, we increased the doses in 150 from 150 till 300 milliliters per day. Together with apitherapy and also with other phytotherapeutic products. And this is the end. Yes, one detail, one doses of this 70 milliliters is the equivalent of 2 liter of virgin olive oil, just to see well the power of action of this extract. That is really very good. Well, and this is, I think, the last slide maybe of our presentation. Thank you so much. And I want to thank you, Stefan, for this effort that you made, that in such a short time, you put together a lot of people with a lot of very important, useful, and powerful information for us personally, our families, and also our patients. Thank you all for the patience and for following our presentation.
Yes, it was also a very nice presentation, and we saw that we should use always in COVID all kinds of remedies, including the ones which can keep under control the mental status and improve it, and so on and so on. Here we have in the chat one question, Ramona.
Yes.
Yes, if you are not able to get the roots of ginseng, do you think can we use the leaves of ginseng, or it's not so effective?
All the plant is good, but the root is stronger. And I don't think, you mean for some infusion, maybe this direction is the question. I think that the root is different. The root was used from 1,000 years in Eastern countries in Asia. Okay. I think it's stronger. Okay. I didn't follow researches regarding the leaves, only regarding the roots, but generally all the plant has this power. If we can make a comparison, the olive tree has this potential all over in all the body of the tree. Just that it's difficult to use well all the body. For this reason, it's easier to use the leaves. For instance, if we can make a parallel, I think that all the plant of ginseng is useful, but traditionally all products generally are made from the root.
Okay. Okay, very good. Any questions or comments to the presentation of Ramona or to our other colleagues? Before we go to the evening break, to the dinner. Okay. So if you have questions, you can raise your hand. Yes, Dr. Ali Timucin, please activate your microphone. Yes.
Yeah, thank you very much, Dr. Stefan again. I just wanted to share an experience that confirms what Ramona mentioned about olive leaves, that we just finished a clinical trial on olive leaves, the effects of olive leaves on COVID patients, and soon we will be able to share the results, and I can tell that our experience was positive, like similar to propolis results. If you want, I can just shortly to give an idea about the results in our water extract of propolis.
Yes, please.
Shall I just share a very small information, if you let me?
Oh, let me
share
put you
the
as,
screen.
yes, I'll put you as, oh, Ramona, oh, we need to,
Okay.
you need to put me back as a host, or,
That's right.
oh, if you can delete your hosting capability. If you go near your name and, or put Dr. Ali Timucin as a host. It's better. You see, Dr. Timucin is just under you, so make him host.
I'll try. I'll
Okay.
try. Yes.
So you click on
Yes,
more near his
yes,
name.
and I thank you very much for the details. I'm very happy that you have come these results with olive tree.
Olive
leaves.
leaves. Yes.
Yes,
Very
I'm very
good.
good.
Very good.
You succeed?
Now you can do the share screen, Dr. Timucin. You are the host now. Yes. Yes, please.
Okay.
Share screen. It should work.
This olive leaves issue was very interesting, that in one factory, there were about 500 patients that they informed us they serve olive leaves in the company, as a drink routine during the pandemic, and they informed us the number of the COVID patients are very low. So can this be a coincidence, or is it, does it have any meaning? So we decided to search about it. There was a peak actually in the numbers of the COVID patients. Why in that factory the number of the patients were very low? And then we made a clinical trial. It was in one hospital in Istanbul. The patients start getting olive leaves, and having groups, and in one of the universities, medical universities based Mealem, one professor from biochemistry, Professor Abdurrahim Koçyiğit, was the leading professor, and the results were very good. And soon I think we will be able to share with you the results. Well, let me share with you our clinical trial results very quickly.
May I say a word? Because maybe after you will continue with propolis. If it's just for curiosity, in last year, when in Italy, in Lombardia, it was the highest, the top of infection. This factory is there in the north of Italy, exactly in Lombardia. I have friends there. I was talking with them very often. It was not vaccine that period of time, and no one no one took the disease. That person didn't start to drink this extract only during this period. They had this habit before. More than this, they gave to hospitals. They offered to patients and doctors, because Italy was known all over the world with that very dangerous situation. So yes, I don't think it was a coincidence about you are telling us. I think that it's really a very good effect and a very good help during this period of time. I apologize for interrupting you. Thank you so much.
Thank you very much for your contribution, Ramona. That was a quick. Yes, can you see the table?
Yes.
So just to give you an idea about the water extract of propolis group and the control group with conventional medicine, you see here that the hospital stay was 1 day less in our study, and oxygen saturation significantly increased after propolis. You see here that it was 84 and control group was 85, and oxygen saturation increased to 92 in propolis group, but in control group it was this is after 1 week, by the way. After 1 week treatment, it was still 87, and CRP levels. You see the in 1 week in propolis group from 70 to 21, and in the control group it was from 67 to 42.
Yes, and
So,
CRP is
for acute phase reactant.
yes. Okay.
Okay. So. Just to give you an idea, I wanted to share with you this results quickly. Thank you.
Stop the share screen.
Okay.
You go up, or click on escape, and then go up on the red button.
Okay.
Yes. Very, very, very good. When do you think you will publish the results?
We will finish the statistics, I think, this week, and then probably in about 1 month it can be published, I think.
Okay. And can you tell us a bit about the water propolis extract you used? A bit, how much concentration, or how did you do it?
It was 3 times a day, 100 milligrams propolis containing extracts. So in 1 day, 300 milligrams were given.
Very, very good. Okay.
Okay.
Yes, excellent. Any comments from our colleagues or questions here? Yes.
I am sure, Dr. Stefan, that from different countries, people experience such things, but if we don't report them, it will be lost. So I strongly encourage everybody to report their experiences. Not important if it is 5 patients or 500 patients, just, I mean, whatever, like Dr. Andres shared his valuable reports, everybody should keep the records and report it. So recording is very important. The details of the patients, we should record and then report.
Yes, yes, you are right. So maybe we can launch one proposal to all people, all speakers we had during this conference. to make a detailed article, like on their experience. And like it was the presentation of Amelia Cristina Torpisano from Uruguay. Very good presentation. But to have it in English, like maybe 4 or 5 pages, and then with all details, and then we can gather, like Dr. Timucin is saying, all this information in one database, and then we can cooperate better together. What do you think? Amelia, what do you think? Amelia, can you open your microphone? Abrir tu micrófono. Sí. Hemos dicho que cada uno de nosotros debemos hacer un artículo detallado sobre nuestra experiencia. Tu micrófono no funciona. Oh, ok. No te podemos escuchar. Eres muy lejos. Ok, no se entiende. Hay un micrófono.
¿Me escuchan?
Ahora sí. Sí. Okay.
Sí. ¿Me escuchan? Ahora sí. Tenemos que hacer un detalle de lo que nosotros investigamos. Yo presenté en un resumen de los primeros meses, o sea, 4 meses, más o menos 5, de los primeros pacientes en Filapi. O sea, hice un resumen y fue colocado como póster de investigación en la Filapi de Chile del 2020. No me he tomado el trabajo de hacer el detalle. Como sigo atendiendo a los pacientes y sigo viendo y sigo recabando información y me sigo nutriendo. Como les dije, primero traté los pacientes que fueron COVID fundamentalmente y los contactos. Traté niños y ahora estoy tratando COVID, pocos COVID, menos COVID, y estoy tratando más post-COVID, que es la complicación que viene atrás. Entonces, y los que son vacunados también, que tienen complicaciones. Entonces, lo importante es trabajar todo con los productos de la colmena, porque yo no solo apliqué el propóleo, sino que apliqué polen, jalea, apliqué cúrcuma con miel, jengibre con miel, o sea que aplicamos, y a los que podían usar apitoxina, cuando estaban en el tratamiento con el propóleo, les indiqué que tomaran en glóbulos o si podían inyectarse, pero no eran todos, que la mayoría usó propóleo totalmente, pero todos los productos de la colmena, todos actúan muy bien.
Okay, muy bien. So Amelia just said that she used all kind of the products. She used also ginger and curcuma and so on. So it was her presentation. Okay. Oh, you need to close. Yes. Okay. Good. Any other comments? Maybe some questions to Dr. Andres Castillo. His presentation was really fantastic. That comparison between the groups was also very, very good. If you can also, Dr. Castillo, to write an article, a detailed article.
Yes, of course, Dr. Stefan.
Yes.
I'm going to make an article and I'm going to continue making the second part of the study. Maybe I have another contribution. One contribution is about fever. And in the first months of the pandemic problems with COVID, I usually use acetaminophen. But after that, I use only ibuprofeno because ibuprofeno was discovered that blocks receptors of COVID in cells, especially in the vasos sanguíneos. How do you say in English?
Blood vessels.
Blood vessels, especially in blood vessels. And the inflammation is very high in COVID, and ibuprofeno is better than acetaminophen. It was discovered in Italy and in United States, and I usually use ibuprofen more than acetaminophen. Talking about fever in long-term effects, in chronic effects of coronavirus, I think that it's better use beehive products like propolis or apitoxin inclusive, and it's not good idea to use ibuprofen or another kind of analgesics or antifebrils. And I'm going to give at this time I'm going to talk about acupunctural points. Maybe it's a good idea to give this apport to everybody. I'm going to share my screen and I'm going to explain about my second part of my study. And I'm going to explain what I'm doing with my patients at this time to prevent and to resolve long-term effects, chronic effects using acupunctural massage, like Tuina, for example, in special points in feet. I'm going to share my screen now. It's not possible at this time to make this. Could you please help me?
So you need, oh yeah, sorry. We need to put you again as Ramona. Can you put Dr. Andres Santiago as co-host?
Yes, I tried.
Okay.
Thank you very much.
You're welcome.
I'm going to explain at this time a special acupunctural system, like it's called tongue. I'm going to explain that. It's not possible to share my screen.
Ramona este chiar sub...
Yeah, it's not possible. I can't do this. I try again.
Oh no, Dr. Timucin, you are Dr. Timucin, you are now the host, and please give the possibility to Dr. Castillo because you are the host now. So click on the near his name on more on the right side. So go to the right side and click on the participants first. Down to the participants. Into the Zoom here, there is a button of participants. And then on the right side and up, where are the participants listed? Okay.
It's very important. Dr. Ali Timucin told about take all the informations and make an statistical information to share and make a very big abstract about around the world. What happened with coronavirus is very, very interesting. And all the things that are related with the high products include apitoxin and all the products. Is very, very important to make this work around audio. Yes, I am host at this time. I'm going to share my screen. Let me see, where is it? Desktop. I want to share my desktop. Yes, you can see my desktop at this time?
Yes.
Okay. Very good. I'm going to explain at this time. I divided all the long-term symptoms in 15. Those are the most important symptoms and signs that I discovered that after vaccination and after contact with coronavirus appear in this kind of patients. 15 are the most important, I think, and divided in 5 groups. But this time I'm going to explain what I'm doing with this kind of patients. For example, in the patients who have problems with fire elements, for example, angina pectoris, that is very common in patients, tachycardia, palpitation, and some problems with the pulse, and ageusia, for example, in the problems with taste, with food or something like this. I use acupunctural points, special acupunctural points called tongue points. The tongue points is a special kind of acupuncture. It's not the same like conventional acupuncture. And I use especially the group 55 that is located in feet, in both feet. It's very important that many people have a right side or left side, like a main side of the body. It's very important in this kind of acupunctural decisions, because we need to use the other side, not the main side that have the person, the other side. For example, if I have my main of problems in left side, I usually right side to resolve these problems. It's very interesting and very important to make this. You can see, for example, in the fire element problems, I usually use a group 55 number 1, and it's located in the second feet in the second, how do you say, Stefan, dedo, finger,
Toe,
feet,
toe,
toe, toe. In the second toe, you can see DMG 5501, and it's located to make a massage, and it's possible to put apitoxin also. In the rest of the feet, it's not easy to put apitoxin because the skin is hard, is gruesa. How do you say gruesa?
It's hard. Yeah.
It's hard, yes, and it's not possible to put these things, but make a massage with using apitoxin or electrophoresis, for example, is a good idea to use apitoxin using electrophoresis or ultrasound system using apitoxin is very, very interesting. And only using feet, I can make this kind of treatments. It's very easy. It's not necessary to make any stinks or something like that. And the results are very, very interesting. It's very important. And the second element, for example, earth, I usually use group 55, number 4. It's located in this area. It's only 1 point, and it's related, for example, with kidney in the normal acupuncture or how do you say, reflexology, for example, in feet. It's like similar, like reflexology. For example, for metal, I use point number 5, that is next to number 4, we can see in the picture. And I'm using for water problems, for example, group 55, number 6, and it's located in the down of the feet, you can see in the picture. And for the end, a little difference, I use point number 2 and point number 3 to resolve problems like insomnia that is very, very common in patients, especially at 3 a.m. and 1 a.m. It means problems with lungs and kidney problems, related kidney, and vesicular biliar, gallbladder. It's okay?
Yes, gallbladder, yes.
Gallbladder is okay. Problem in this energetical canals. And I use number 2 and number 3. In number 2, I have 4 points. And in number 3, I have 2 points. And it's very unusual use to acupuncture, but it's very hard to resolve this kind of problems. And at this time, I am making my study using this kind of points and using apitoxin in all of cases. Thank you very much. This is the suggestion for everybody.
Okay. One let's say suggestion from Japan. Maybe you remember Dr. Castillo in 2007. It came Dr. Hirofumi Naito, the Japanese guy.
Yes, Naito Hirofumi. Yes, of course.
The microstings.
Microstings, of course.
Yes, and he told us when sometime we need to sting, microsting areas with very hard, very thick skin, like here on this area. He told us to put for 15 minutes, 30 minutes, coconut oil.
Interesting.
Yes, so when you put coconut oil and you let it stay there for about 30 minutes, then the skin becomes soft. And then you can do the microstings. So you can try on these points, why not? To put the coconut oil first for 30 minutes and then maybe can go through microstings to stimulate them stronger.
I usually also electrical equipment to give a little of electricity in the point, and it's a good idea to use it. And all time use apitoxin like cream or another ways like electrophoresis or ultrasonido.
Okay, very, very nice. Very nice.
Thank you very much.
Thank you very much. Yes, good stuff. Okay. Now I will ask you, how are you with your energy? We have two options: to take the dinner break, maybe 1 hour, and come back for other discussions, or we just close the conference. What do you think? It's maybe we can vote. Like who is to close the conference? Should raise the hand, the yellow hand, because I see we do not have any other speaker. It was one colleague, but she didn't come, and also it was one very good friend from the United States. He's now in Brazil, but I do not see him among the presenters. So we should close, says Vanja Kinutia. Okay, very good. Okay, Dr. Timucin, you'd like to say some things more? Activate your microphone. Yes.
Yes. Well, it was a quite busy event, I think, Dr. Stefan. And I think people might be tired. Our colleagues and friends need some resting as well. If we are going to talk about apitherapy, we have to, I think, give chance to rest as well. So, and tomorrow is Monday, working day.
Yes.
So I suggest if there is not any opinion or sharing, we can maybe close. It's
Yes.
you are the president of the
Yes.
event, so you may decide, I think.
Yes, yes, okay. Yes, you are right, Dr. Timucin. It's just to give you again the technical things. First of all these presentations will be published in YouTube also. So tomorrow I will take care about publishing all these papers, presentations. I will send you the links to these presentations through our groups, WhatsApp groups, and by email. And then whenever you have any questions regarding our speakers, you can also write me an email to my dear Stangaciu, or dear Stangaciu.
Okay.
Yes.
السيد Stangaciu, السيد in Arabic, السيد, monsieur.
السيد.
السيد Stangaciu.
Okay,
Thank
okay.
you, Stefan. It's very, I have a lot of work because tomorrow, as Timucin told us, we have a commitment for doctorate in the university. We have a lot of work, but I had been very happy for all conferences. I missed the conference of Timucin on the Riyadh, but Amelia, I would like to have the email of Amelia.
Okay.
Amelia, very good curcumin and ginger, and also Ramona. Very interesting. Thank you very much for this good job. Thank you, Stefan.
Okay, thank you very much also, Professor Badialiusi. Wonderful. Okay, so we'll stay in touch. We have our emails, our contacts, and let's be healthy and stay healthy all the years to come.
Dr. Stefan, thank you very much for this nice organization, and hopefully see all the colleagues next year.
Yes, yes, everybody. And maybe we'll organize another, maybe larger conference on against apitherapy against COVID, maybe 2 or 3 days under the auspices of our federation.
Perhaps also, Stefan, perhaps in Morocco, I will
Yes.
see if possible to make it will be very interesting for our university medical school. I will discuss and I will talk to you in order to organize this. It will be very interesting because we have olive oil, we have medicinal plants, chemotherapy, aromatherapy. It is very interesting. We have a very good alternative medication. Thank you.
That's a good news, Professor Bedialusi. Thank you.
Yes, it will be very interesting. I will organize this because online, and we have a very good recommendations because I use olive oil, I use essential oils from oregano. It is very interesting with propolis. It gives us very good to reduce fever, with zinc, and it is very interesting to make, as Timucin told us, a book with these fruits, legumes, spices to be used. It is very interesting. Very interesting. Thank you.
Yes, it's really a very good idea to make a big book on aromatherapy
yes,
against the COVID. Maybe we can make like editorial work. And,
yes.
Professor Liusi could be one of our big editors of this book.
Inshallah.
Yes. Okay. Thank you very much again and again. And see you in the next events, international events. Thank you very much. Okay. Bye-bye. Oh,
thank you.
Yes. Okay. By the way, we can make the photo group. We forgot like the last conferences. Please, all participants, please activate your camera to make the photo group. Okay, now you can activate your cameras. Yes, very nice. I see also Azra, very nice. Maria Alejandra, okay, you should have been one of our speakers. Okay, good. Maria, very nice. Everybody else, please activate your cameras. Okay, I see here the first one. Okay, very good, very good. Marilena, very nice. Yes, very good. Okay, a bit too much light. I'm looking. Esther, if you are not here, maybe. Yo, Lestina and Lema, where are you from, Lestina? From what country? Yes, activate your microphone, Lestina. Lestina and Lema.
From Malawi.
Malawi, Southern
Yes.
Africa. Wonderful. We have had so many African people. Oh, and Jonathan from Chile, yes? Chile, Jonathan? Yes, very good. Oh, Brazil, sorry. Yes, very, very, very good. Okay, so we have the people and Professor Desmiran. Very, very nice. Thank you, Professor, for joining us for the photo group. And now, okay, now your best...
No me habilitó a mí, me sacó del
¿Qué?
grupo.
¿Quién
Yo
es?
hablo Esther.
Oh, Esther. ¿Por
Sí,
qué
estoy hace
no?
rato,
Oh, okay,
pero
okay.
no tengo...
Ahora, prueba ahora tu cámara.
Bueno, a ver.
¿Puedes activar tu cámara, tu video cámara?
Sí, ya estoy.
Sí, perfecto, perfecto. Okay. And
Sí.
Belladonna, are you here with us still? Belladonna is from Arizona, from United States. Maybe you can open your camera too. Oh, yes. And put the camera a bit down. Yes, very good. Okay, so see, we have nice faces, nice smiling faces. Yes, very good. Okay, so best smile. And by the way, if you have, you can print, you can press on your button, print screen, all of you. So one, we wait for Ali Rehan from Palestine. Ali, yes, Ali, thank you for coming near us. Okay, so 1, 2, 3. Very good. So I've got it. I'll put it here. Okay. Oh, wonderful. We have the photo group. Perfect. Okay. Thank you very much from the bottom of my heart. It was wonderful to see you. It was enlightening. It was a lot of knowledge and a lot of friendship, international cooperation. We have had very good conferences before, like I see here, Azra, she organized in Bosnia, a very good event. And I'm sure next year we'll have many more Zoom conferences on all kinds of diseases. Thank you again and see you soon. Okay, bye-bye.
Bye-bye, thank you.
Bye-bye.
Thank you very much, bye.
Thank you.
Gracias, gracias por
Bye.
todo.
Thanks all.
Bye-bye.